That is down at the bottom. So you'll see on your Zoom screen, if this is the first time you're joining us and using Zoom, you'll see there's an area that allows you to definitely chat. It's going to be about the fourth icon from the left. It says chat with a bubble and 3 dots. You can leave any type of questions that you might have as we're going through our webinar today for Karey. And we are going to actually have a great time with her at the end of our presentation to answer these questions as well. So that's also super exciting. And again, thank you so much for those of you who've just joined us, for being super patient and really just being super flexible really in this time to join in and be able to really have an awesome time meeting and chatting with Karey today. So during this time, again, if you have questions, just go ahead and use your group chat. You'll notice that there at the bottom you can type a message. If for some reason you don't get a reply from me, so my name is Beth Bialco, please know that we are going to get to these questions towards the end of our presentation today. We'll have time for Q&A for sure. We are also recording this webinar today too. So that's going to be fantastic, especially if any of our attendees tend to come in late and join us so they can come back and watch this. And of course, we'll be hosting everything with the Dermal Institute website. So again, just kind of looking at our time, we just want to give it a couple more minutes for everyone to join us. Looks like we've got some great participants already. Again, thank you so much for joining us today on, I think it's Thursday. So Thursday afternoon that we can get together in a whole new way, really being virtual and staying connected. And we're so excited that we could keep everything on schedule for you as far as keeping this webinar on our calendar. We are looking forward to doing more webinars like this as well with some great hot topics. And the session today is presentations going to be just about 45 minutes. And then we're going to do a 15-minute Q&A. If for some reason, again, you've got things that you need to do, you need to log off early or you need to jump off, totally understand. Again, we thank you so much for your patience and joining us a little bit later. We are recording it, so you'll be able to log back in later and watch the full webinar in its entirety as well. So, okay, well, I think we've got a great number of participants here this morning. I'm gonna go ahead and just kick off our kind of topic for today. And as we know, it's about oncology and skincare. And this is really, I think, a very interesting topic. It's also a necessary topic as providers, as therapists, to think of, because honestly, the way that skincare is happening in our industry, we have to be flexible in knowing that there might be clients coming into us that could possibly be being treated for cancer. Maybe they are post-recovery. Maybe they have experienced it in the past, but it's been maybe a year or so, but there are still side effects that they themselves and their skin can definitely be experiencing as well. We're going to be exploring so many great points and topics about this so that you can kind of understand some of the changes and adjustments that we need to make as skin therapists for these clients that can come into our treatment room. And Karey is going to be taking us through that. So for those of you who maybe aren't familiar, I'm going to give you just a little bit more information about this. This is going to be going into our recording for our webinar today. And Karey York is going to be joining us. She has over 20 years experience in advanced skincare education. Karey is going to be bringing up her PowerPoint right now so we can share that and be able to see it as well.
I'm working on that.
Okay,
I don't
great.
know how that happened, but it disappeared and it got pens on it. because I'm a little challenged. So I don't know how to share it again. I could call my IT department in.
That's okay. You know what we can do? I also have the presentation, so we can bring it up for you for having issues with that. And again, today's technology, we want to just be sure that we can flow with that as well, Karey. So
Okay.
do you want me to go ahead and share your presentation?
No, I got it. Thank you.
Okay, great, perfect. So while Karey's bringing that up, a little bit more about her. So Karey York has 20 years experience, as I mentioned, in advanced skincare education. She is a licensed esthetician, massage and manual lymphatic drainage therapist, and a spa consultant. She also has a bachelor's degree in sociology and gerontology. Now, Karey runs a program at the Hoag Family Cancer Center, and this provides support to patients focusing on skin changes during and after cancer treatments. And I think also too, Karey is the perfect person to be talking to us today about this because she herself is a breast cancer survivor. And she's very aware of the importance of assisting all patients in feeling more comfortable with this part of their new life. So she's actually been with Greet the Day since 2011. And as Greet the Day and the International Dermal Institute, we've partnered many times actually on courses that are about a 3-day course to be able to train the skin therapist in working with a cancer patient. Some of you maybe tuning in have actually maybe had that course before. We are going to be partnering up again this year for 2020. So we're excited to be bringing that opportunity to you for the skincare oncology course that is brought to us by Greet the Day and hosted by the International Dermal Institute. And Karey and I have actually known each other for a long time. We used to work together as instructors. So we've known each other since about 2004, 2005. And what's interesting, I think, is what's great to know, we have these scholarship winners out there as well from IDI, from our Lisa White Spearing Scholarship. Both Karey and I worked with Lisa as well. And so we're both super passionate to be bringing you this information today, and also to be really, you know, carrying on Lisa's legacy, and then also to just supporting you guys in this ever-changing world of our skincare industry. So with that, I am going to hand it over to Karey and let her go ahead and start sharing with you all the wonderful information that she has brought to us today in our session. So Karey, I'm going to mute myself, hand it over to you. And again, if you guys have questions, just put that right in the chat box and I'll be happy to assist.
Well, thank you so much, Beth. I'm really, really excited to be here today. And I really appreciate that you all are hosting this webinar. It's a topic, as you know, that's near and dear to my heart. I'm going to go ahead and take myself off screen because I'm not used to looking at myself while talking. And it's a little bit different for me. So just going to remove myself and get going. Thank you so much to everybody who has decided to be here today. I know it's a really crazy time for our industry, and especially since our businesses and livelihood has not been categorized as an essential service, it really has impacted us in many ways. Where our world, or my world and my work world, hasn't been impacted is that I work in a cancer center and everything is status quo in the cancer center because as you know, cancer treatment is deemed essential and cancer treatment doesn't stop because of what's going on in our world today. And I really appreciate all the people that came here today because I realize that you're not stopping, you're learning and being excellent practitioners out there. And another thing that you can do after the day, after this program is done, is you can go out, you can share this information with your clientele via Facebook Live, Instagram, or whatever social media outlets that you utilize to really help people know that you still are passionately strong about your business, even if you can't be meeting with people face to face right now. So today we're going to look at some key topics that therapists want to know, questions that always come up, the steps to take when bringing this clientele in, and what you can do today that's going to help you identify these clients in your practice. But before I do that, I do want to mention that we at Greet the Day are over the moon with our continuing relationship with IDI and Dermalogica. We had our first class with them at IDI Corporate in Carson in the beginning of 2013, and we followed later in that year with our 3-day course in oncology, skincare, and facial treatments. We've had numerous therapists go through, some of which names I recognize that are here today, and that's not only therapists that have practiced and learned in the United States, but also abroad. But one of the things that people don't always realize when you are taking this particular class through IDI is that International Dermal Institute has been sponsoring or hosting our courses. And that means that everything that's provided in the class, the linens, the beautiful space, the classroom, the practical room, the products, the marketing, all of these amazing things are happening, but they're not taking any money away from the fee that you're paying. It's all philanthropic. They're not adding to the fee either. And you may be thinking, well, gosh, today I spent some money and I'm wondering where this money is going. And I just want you to know, the first and foremost is that your investment today is directly touching cancer patients. Your contribution is more than a donation. It's the catalyst that will improve the experience of cancer treatment for people out there. So I just want to take a moment to sit in gratitude and say thank you. Thank you for being here. Thank you for holding the space today. I really appreciate it. So we're going to talk about oncology skincare treatment insights for the next hour. But before we get into that, I really want to share with you a little bit about who Greet the Day is. So Greet the Day is a nonprofit organization that's been nurturing well-being since 2003, and their home base is in Orange County, California. We work hand in hand with cancer centers and clinical staff and provided thousands of hours of oncology massage, skincare, and supportive holistic health practices for people facing challenges of cancer. Greet the Day was started by 2 bodywork therapists and a physician, Dr. Christine Tinka Harantas. Dr. Tinka is a breast cancer survivor who also has lymphedema, which is something we're going to talk about a little bit later today. And one of the bodywork therapists, Jeanette Duran, who I work closely with, she is also a recipient of a humanitarian award, and she received that in 2008 for her work in the Clinical Cancer Center. Jeanette and Tinka took Greet the Day in the direction to bridge the gap between patient need and therapist skills. So they worked with others in the oncology field to develop patient service programs and professional training for therapists to be able to work with this medically sensitive clientele. So it started with Spa Day Retreat. It was the first community program in 2003, and it was happening at Spa Gregory's in Newport Beach. This program is a half-day program, which is nurturing and restorative, and it's for a group of people, and they're hand-selected by cancer centers, either nurses or social workers or patient navigators. And this group of people start in restorative exercises, whether it be mindful breathing or moving meditations, guided visualization. And then from there, they go and receive treatment, whether it is massage or skincare treatment. And they're getting these services provided by an oncology trained therapist. After they receive the treatment, they come back as a group and reconnect over a shared lunch. And this is the part where you really see the magic of how people shift after doing some self-care in a service like skincare or massage. And they become different people after all of that happens. We choose people for this, or they are chosen by the nurses and social workers to be people that are at the end of treatment. And this is really important because we want them to move from that constant clinical appointments to a new practice of nurturing their self. Besides Spa Day Retreat, we also do massage in the infusion centers. So Chemo Comfort Touch started in August of 2006. And what Chemo Comfort Touch is, volunteer therapists, be it massage, skincare, or nail technicians, go into actual infusion centers and they will offer massage, either hand or foot massage, to patients that are actually receiving chemo. And it is no charge for the patient. They can say yes or no. There's no pressure to get a massage either. Um, and we've been doing it for many years with great success. And I just want to mention too that we currently have an esthetician on staff at UCLA providing infusion massage, and she's on staff, as well as at Hoag where I work, we have a massage therapist who's on staff. And just this week, we announced that a massage therapist joined St. Joseph's staff as well. So it's really going quite well. Not only are the volunteers providing infusion center massage, but now we have 3 hospitals that have full-time staff that provide that for their patients, which is just amazing. Beyond that, we do massage in inpatient as well, so actually in the hospital, and we started doing that in 2012. Again, a 20-minute practice, and it's a bedside massage, no charge to the patient. And we've been providing this at UCI in Orange and at Orange Coast Memorial, which is now Memorial Care. And the therapist will work with patients on the oncology ward. And these patients may have been in hospital just for a day, and we're trying to manage the stress that comes with the new diagnosis. Or some have been in hospital for 40 days plus. Again, they're receiving a 20-minute massage bedside, and it's the nurses and social workers that select the patient roster. We also have hospice affiliations, and one of the things we do there is group meetings for their volunteers to help them to understand how they can safely provide calming touch for people that are close to end of life, which is near and dear to my heart. So the key component of Greet the Day is that we're focused first on education, first on wellness, then education. And Greet the Day therapists work in a variety of different settings, be it private practice, wellness centers, and spas, and also, as I mentioned earlier, on cancer centers. Our community programs are mostly provided by volunteers, and it served our volunteer therapists very well. So one of the great things about volunteering with Greet the Day is it's going to provide you access to work with numerous oncology clients, which is an educational experience that's unparalleled to anywhere else. So what is gained is the practical experience and knowledge that comes only from working with many different people, all at different stages of treatment and recovery. It also helps you to develop relationships of referral with clinical professionals who trust the safety of your service, believe in the value, and are comfortable making a referral to you. So I am the first to say, as a businesswoman, that therapists should be recognized for the value of the service they provide and compensated for it. But I'm also the first to say that there's no education experience comparable to being actively engaged with numerous different oncology clients at all different stages of their treatment, nor any better way to build relationships of referral. So a little bit more about Greet the Day. We are a multidisciplinary team of massage therapists, skincare therapists, nail technicians, yoga teachers, physicians, nurses, social workers, and we have programs that are offered in more than a dozen cancer centers, and this is just a few listed on your screen right here. When we started, we really didn't know how warmly embraced we would be by the oncology clinical teams. But oncology, more than any other branch of medicine, is at the forefront of treating patients as a whole in mind, body, and spirit. And Greet the Day has nicely found a home in the bridge between clinical care and wellness practices. We work with all cancers, all people, all stages of life. And it's really important for us to stay in contact with and close collaboration with clinical professionals. We realized early on that for every therapist we prepare to safely work with oncology clients, we could positively affect the lives of hundreds of oncology clients. But if we expand that, and for every clinical professional, whether it's oncologist, nurse, social worker, the patient navigators, every one of them who understand the importance of oncology trained therapists can literally affect the lives of many thousands of patients in or with a history of cancer treatment. So although we have wellness programs based in spas, yoga studios, and community centers, a large proportion of the community services we do under Greet the Day umbrella is in the clinical cancer setting. So a little bit about Greet the Day for those of you that wanted to know a little more about us, but let's look at today's objectives. And I just want to do a gentle reminder that today is an overview. It's a small snippet of what we cover in our 3-day training. And let's go back a little bit. It is appropriate that cancer is taught as a contraindication during our preparatory training. Oncology, massage, and skincare is an advanced field of study, and with appropriate postgraduate training, treatments can be provided safely and with therapeutic benefit. However, for our 3-day program, we require therapists have worked for a year before attending our class. And we have made exceptions for nurses and doctors, but it's really important because there are so many things that we learn with a medically uncompromised client that it helps us better understand the unique and changing needs of our oncology clients. And actually, we believe it's a looming oversight that cancer as a contraindication isn't broad enough as that statement. The contraindication should really include anyone with a history of cancer treatment. So my understanding of the law is that if you are 7 years out of your cancer treatment, then it's safe to work on this clientele. And we're here to say that no, that's not the truth. Cancer as a disease process in and of itself does not provide working guidelines and boundaries for us as therapists. It's most often the side effects of cancer treatment, immediate and long-term, that present the true boundaries and guidelines for us as therapists. So that's the most important key, is that it's the side effects of cancer treatment, not only in the immediate, but also in the long term, that present the true boundaries, the true contraindications for us as therapists. And it's not a contraindication if we are taught to work safely with this population. So whenever we are talking about therapist guidelines for oncology clients, there are always 3 very separate and apart conversations we're having. One, is the client in active treatment, or are they in recent recovery? 2, are they in long-term survivorship? And 3, are they in a place where cure is not objective, but the quality of life is the goal? And regardless of which of these conversations we're having, we want you to be able to work safely with all of this clientele. So anyone who has ever received any of these primary treatments ever is going to be one of your oncology clientele. So chemotherapy is the first thing, or drug treatments is the first thing that comes to mind when we think about cancer treatments. It's a very smart drug. It has the ability to target fast-growing cells in the body, and it destroys them. What it's not smart enough to do, though, is distinguish between fast-growing cells that are cancer and fast-growing cells that are healthy. So the fastest growing healthy cells, those most affected by chemotherapy, are skin cells, blood cells, and the gastrointestinal cells. The most common skin side effects that happen with chemotherapy are sensitivity, fragility. We see a lot of dehydration. We see inflamed, irritated skins, and also skins that are very sun sensitive. And some chemotherapy agents dependence can also cause severe blistering and acne type lesions. These side effects are experienced in all skin cells of the body. There are other primary drug treatments out there. There are biological or hormonal therapies, not chemo. They are more specialized treatments. And although they're not chemotherapy, their side effects are very similar. So some of you may have heard of the brand names like Herceptin, Arimidex, Tamoxifen, Femara. These are all different types of these biological or hormonal type therapies that people are on, where they experience also the same skin side effects as a chemotherapy. There's also radiation therapy, which utilizes special equipment to deliver a stream of high energy particles, and this is a targeted type of treatment. So in contrast, the skin side effects experienced with radiation are localized, experienced only at the site of radiation. These skin side effects are most often experienced as burn-type effects and are often long-term side effects of the treatment. So an example of a long-term side effect is lymph nodes in the field of radiation. They will forever be compromised, and the client will always need to have hands-on modifications provided during the service. So sometimes people will ask, um, will I be receiving both chemotherapy and radiation? And sometimes yes, sometimes they'll receive both of these, sometimes they'll receive all three of these, chemotherapy, radiation, and surgery, but not always. So chemotherapy is a drug treatment that works systemically, i.e. in the system, in all cells of the body. Drug treatments like chemotherapy are used when cancer cells have or are thought to be able to spread throughout the body. And these drug treatments affect all cells of the body, the cancer cells and the healthy cells. Their effect on the healthy cells is why we have all the side effects we have. And in contrast, radiation is targeted treatment. It's area specific. Radiation only affects the area of the body receiving the radiation. A very simplified analogy of this would be if you are doing laundry, you are going to use a spot remover to target a stain on a shirt. That would be akin to radiation. Whereas once you're done treating the spot on your shirt, you're still going to launder the shirt because you want to make sure that the rest of the dirt and debris is out of the shirt. And the chemotherapy would be the example of laundering the shirt in this situation. And then many people will receive surgery as well. So as estheticians, chances are likely that we aren't working on someone who's just had recent surgery, but we do need to keep in mind the side effects of the surgeries and how they affect the skin. And it's also worth noting that many cancer patients may have a medical device that's in our area of service. So commonly, someone may have what's called a portacath or catheter advice. Portacath is a brand name on the décolleté area, or sometimes they'll have an inserted catheter. Often this will be in the arm, upper arm, and so again, that's something that we might visually see in treatment. And sometimes this can be in the neck area, which we may see or possibly feel when we're doing applications of product on the skin. So it's important to know that although people aren't coming to us for right away after surgery, it's the side effects that are important and the medical devices that may be present when we're doing these services. I think that more importantly, we need to note that as skincare therapists, we see the most vulnerable of oncology clients, people that are seeking skin treatment. And it's not only because they're experiencing a skin that's very uncomfortable to live in, it's tight, it's itchy, it's inflamed. So they want relief for their skin, but also many times clients believe that a skin treatment is less physically demanding than going in to receive a massage. So as skincare therapists, we're known for gentle touch and really nutritious or nourishing type of care. That was really hard for me to say. But also as a client, as a person that's going through chemotherapy, radiation, surgery, I might not choose to have a massage because simply I don't want to lay on my stomach. I don't want to lay face down. It could be that I've had surgery and I'm not comfortable laying on my stomach. It could be that the radiation burns make it uncomfortable. Or if I'm still in active treatment, I may be experiencing nausea, anxiety, nosebleeds. All of these things are going to make me choose not to have that more demanding treatment like a massage or something where I would lay on my stomach. But it's the esthetician that really needs to have the advanced training because we are working with product and we're working with heat. And it's those areas that can cause problems. And we'll talk about that in a little bit. But what is most important for us to remember is the side effects on the skin, and also sometimes there's going to be more of a physical manifestation, a more visible physical manifestation, and that could be hair loss. So this is one of my favorite pictures of this presentation. It really represents the ah, that you can feel, the sigh of relief, the therapist calmly holding the space and being present. It's absolutely beautiful. It's also how many people presume an oncology client presents themselves, but I'm here to say that they're not always going to present themselves in a physical way that you're going to be able to visually see that they're going through treatment. And this may bring up a question for some of you. Can I work on a client who has active cancer? And I'm here to say absolutely you can. You just need appropriate training. Let me just take just out of there. You need appropriate training so that you can safely work with clients who are in active cancer treatment. And that said, it's very important to remember that people with a history of cancer treatment require the same care and consideration from therapists as clients in active cancer treatment do. It's the long-term side effects of treatment that are most often overlooked and underestimated. So with appropriate training, yes, you can work on this client. Yes, spas can provide a much needed and very valuable service for people in active cancer treatment and long-term survivorship. But for the therapist who's hoping for the best and doesn't properly understand the needs of an oncology client and then their new normal, it's that therapist who's at risk of doing harm, which can have long-term detrimental consequences for their oncology clients. So this is an instance where your intentions are not enough. So I really want that to be heard. So sometimes we go in with the best intentions, and we also want to go in helping people, maybe fixing their skincare issue. And I really just want to reiterate that hoping for their best is not going to be of service to these people. Moving on, our clients feel our sacred space and they're comfortable sharing with us. So for those who are going through a cancer journey, it might be the only place that they have an opportunity to talk about this specific side effect that happens from chemotherapy, and that's hair loss. And there are so many questions that come up, and as a therapist, we're not going to have the time to answer all the questions. They may look to us because waxing is a service that we offer, and so they may see us as someone that knows a lot about hair and the hair growth process. So it's something that may come up in your treatment room, and it's something that I think if you have a few key understanding or answers to these questions, that you'll be able to handle this conversation with ease with your clients. So not all chemotherapy causes hair loss, and not all hair loss is the same. So some chemotherapy drugs will affect only the hair on your head. So you'll see people that have lost the hair on their head, but they have their eyebrows, and which you're thinking, well, I thought they were going to lose all their hair. Not all chemotherapies affect all the hair. Most often, though, your client's going to experience loss of eyebrows, loss of eyelashes. They're going to lose their hair in the pubic region, their legs, arms, underarms. And that is if they're on a chemotherapy that causes hair loss. Sometimes they'll lose hair on the whole of their body, even their nostril hair. But it's not just chemotherapy that causes hair loss. Radiation can cause hair loss too. And how that's going to happen is it's going to either happen in the area that they are being radiated in. So if a woman is going for if they have breast cancer and they're getting radiation in the breast area, and maybe that woman happens to have hair on the areola, that hair will be gone in the area of radiation. Or possibly if that radiation beam is crossing over underneath their underarm, they might lose the hair underneath their underarm. And that's site specific. So then if you think about radiation to the brain, which is used to treat metastatic cancer that is now in the brain, it will usually cause complete hair loss on the head. And the hair regrowth for that is going to be much different than the hair regrowth from somebody that's on chemotherapy. So it may take as long as 4 to 6 months before even an inch of hair growth appears on the top of the head. And sometimes there'll be bald spots where that beam was um, focused. But it's the chemotherapy-induced hair loss topic that gets the most questions. And I think it's understandable that people have a fear of the unknown, and if they've had their first chemotherapy and they're waiting for the hair loss to happen, that's when a lot of questions come up. Some things that we can say to our clients that are helpful is that chemotherapy-induced hair loss or alopecia is usually temporary and completely reversible once therapy ends. And if we provide them with the information of how the hair is, what's happening to the hair. We mentioned earlier that chemotherapy targets all rapidly dividing cells, healthy cells, as well as cancer cells. And hair follicles are some of the fastest growing cells in the body. And hair shedding is something that is a very natural process, of course, but losing it all at once can be scary. So on average, we lose about 100 hairs a day. And this may seem like a lot, but 100 hairs isn't really that much if you consider we have 100,000 follicles on our head. And daily hair loss generally goes unnoticed. It's like I mentioned before, it's when it all starts coming out that it becomes a little bit unnerving for people. People may ask you if they should be utilizing, and possibly you retail some of the products that are hair regrowth products, some of the lash growth serums and brow growth serums. And a person that's in chemotherapy should, well, I'm not going to say should, but I wouldn't recommend using those types of products while they're on the chemotherapy because the chemotherapy is going to stop the hair from growing. So it's going to be best suited to recommend those products after they've completed chemotherapy. And then sometimes people will ask if they have any way of preventing the hair loss. And there are head cooling treatments out there, or scalp hypothermia. There are 2 brands out there. One is DigniCap and the other is Paxman Cooling Systems. These are the 2 that are on the market that have been approved by the FDA, although there are multiple ones out there. What this is it's a cooling apparatus that is placed on the scalp. And by doing so, this is going to help the hair follicles to absorb less of the chemotherapy. So it reduces the blood flow and slows the normal cellular activity to the scalp. I do have to say that this treatment is a little bit on the expensive side, a little bit uncomfortable, very labor intensive, and not all oncologists are on board with this procedure. And the reason they're not on board with it is that there is a concern that not all cancer cells will be treated, that there'll be a couple rogue cells that are up by where you're freezing your hair that are not being affected by the chemotherapy. And I just want to mention too that I mentioned it's expensive and it's rarely covered by insurance. So there are some pros. I've seen it very helpful in some cases, and I've seen it not work. So if someone's asking, you know, can they prevent their hair loss, there is an answer out there for them, and it may be right for them or it may not. What is important to note is if they're deciding to do any sort of scalp hypothermia, the decision must be made before any chemotherapy is administered. So if you have a client that's asking about it, but they've already received their first chemotherapy, it's too late to make that decision. They need to decide that before having their first chemotherapy. The hair, when it comes back, it's really interesting. Some people say, well, my hair was never this color before. And it's interesting because are they people that had dyed their hair in the first place? Because they may not remember what the hair was looking like. But realistically, it's not that uncommon for the hair to come back in a kind of grayish tone. It's due to the loss or change of pigment. So sometimes it comes back white, gray, or kind of a grayy beige. And it's different from their natural color, but as their body recovers, the pigment will rebound and their hair may return to its original color, type, and texture that they had pre-chemotherapy. But that's a big may, because there's a lot of things that can happen. So let's look at who is an oncology client. So you look at this picture and you see a couple having a lovely dinner out. And I ask, so which one of these people is the oncology client? And the answer is really, it could be either of them. You never know. So the number of Californians alive today who have been diagnosed with cancer is 1 in 2.5 people of all ages, and 1 in 4 people under the age of 50. So you may already have oncology clients in your clientele, and you don't even know. And there's a lot of truth to the fact that many oncology clients don't self-identify. And you might be wondering why. Oftentimes, they're tired of writing it down or reliving it, don't understand the importance of the information, think they may be turned away from a spa service, whether it's facial massage or anything like that, or it's so far behind them that they want to walk away from it. They want to forget that they had cancer sometime in their past. So it's a high likelihood that you've already have oncology clients in your existing clientele. I recognize that for a variety of reasons, you may not always be able to do a consultation in the way that we're trained to do one at IDI. I also recognize it's not always appropriate to take the word cancer into every service that you do, but there is one key intake question which you should be asking all of your clients verbally, which will help you ID many of the oncology clients you've not been aware of. So your client consultation is key. And we have a consultation card. It gives us a lot of valuable information, including some of the primary clinical considerations, which we'll look at more in a minute. It also is going to help us understand medication, surgery, and lifestyle that are going to contribute greatly to the general health of that person's skin. In this case, increased sensitivity for someone in active treatment or recent recovery. Our consultation card also helps us to understand the stress levels, which we know with this client, we can just assume that are pretty high with this clientele. But you may want to implement some verbal intake when you realize that you have a client that's going through a cancer journey. It can be very telling what they'll say. And sometimes people just aren't going to put it all down on a consultation card. So if you have the opportunity to ask them what type of cancer, how it was treated, how long ago was the treatment finished, did they experience side effects, what were the side effects, are they on any long-term medications? So these are great questions for people that we know are in or have a history of cancer treatment, but it doesn't cover everybody. But this is great to start gearing towards your people that you know have a history of cancer treatment. Other safety considerations are the product choices that we'll be doing. So moisturizing, I can't say enough, moisturizing is key. As you know, moisturizers help combat skin dehydration. They make the skin surface softer, more pliable, less itchy. We can recommend also and practice with hydrating masks, serums. All of these things help ease that discomfort, that uncomfortable skin. So you might be sensing a pattern here. We see a lot of dehydration, a lot of dry skin, a lot of sensitive skin types. And their physician's also going to be telling them to avoid long hot showers, perfumes, or colognes. So anything that's going to further dehydrate that skin, the physician has recommended as well. So in the treatment rule, we're going to use our less rule. So when it comes to heat, you know, we're still going to utilize steam. We're just going to utilize it for less time, or we're going to pull it further back. When it comes to the friction, we're going to exfoliate, but maybe we're not going to use a strong granular type exfoliation. We're going to use something a little bit less aggressive to the skin. Our European massage movements, we're going to slow down, and that's going to slow down the friction on the skin. Extractions may not even happen, but if they do, really minimal, because this person's going to be more susceptible to easy bruising and easy bleeding. The product choices, we're going to keep it simple. So we don't want to trigger inflammation. So we're not going to use strong exfoliants. We're not going to alter the pH of the skin. You know, things that we normally do on a healthy or an uncompromised skin, we're not going to do. and less time. So no more than 30 minutes of active working on the client. It's possible that changes to our client's physical appearance might happen somewhat immediately. So some awareness factors. Don't be shocked if you see a marked difference in hyperpigmentation or hypopigmentation, increased vascularity due to steroids and the drugs that they're on. Sometimes you'll see acne-type lesions. You might see hair loss, but also sometimes because of steroids, you'll see an increase in hair growth, especially on the face. You may see facial swelling, or what's referred to as moon face due to steroids. So your client's physical appearance may change quite rapidly, and these are just a few things to be aware of. I mentioned earlier to possibly slow your movements down with your European massage, but also your pressure modifications. You're going to lighten up your touch. So just as we don't want to trigger inflammation in the skin, the same is with the inside of the body. We don't want to trigger inflammation by creating too much pressure on that skin. When we create inflammation, the white blood cells are alerted, and they have a bigger job right now, and we don't want to pull them away from that because of the treatment that we provide. So we talked about a couple clinical considerations like easy bruising and easy bleeding with extractions, and also we don't want to trigger inflammation or the inflammation response with massage pressure. But there are many clinical considerations for people in cancer treatment or a history of cancer treatment that we need to take into consideration. So your treatment objectives are going to vary based on clinical considerations. So many people think that chemotherapy is most of what there is to know about cancer treatment, and nothing can be farther from the truth. The therapist needs to understand cancer as a disease process, the primary and co-prescribed medical treatments, the side effects related to medical treatment, and the effects of disease progression. An oncology-trained therapist is able to recognize and safely work within this framework of clinical considerations, which are unique for each client. During chemotherapy treatment, primary clinical considerations for the client will include, but are not limited to, the following: compromised blood cell count, blood clots or risk thereof, medical devices, be it a portacath or ostomy, compromised immunity, which is one of the most serious risks a cancer patient faces. It's the risk of developing an infection, vital organ involvement, which is a long-term side effect that is caused by a disease or a treatment of disease and continue for many months or many years, side effects of co-prescribed medications, and the client's experience of pain, fatigue, nausea, and neuropathy. Cancer as a disease process in and of itself does provide working guidelines and boundaries for therapists. It is, however, most often the side effects of cancer treatment, both immediate and in the long term, that present the true boundaries and guidelines for the therapist. What would our treatment objectives then be? We want to do skincare treatments that calm and soothe, hydrate, replenish, repair, and strengthen the skin. Clinical research also shows that massage reduces pain and anxiety during cancer treatment, and client feedback supports the use of massage also in reducing fatigue, insomnia, and nausea. All of this, and it just feels amazing too. One of the biggest things that I want to highlight today is recognizing lymphedema or the risk thereof. It's the key safety consideration that we need to be aware of as skincare therapists. So we just had World Lymphedema Day on March 6th, and I just heard rumor that March is actually Lymphedema Awareness Month. So this is good. More and more people are understanding what lymphedema is. It's a very serious long-term side effect of cancer treatment. It's uncomfortable, as you can see in the images that are in front of you right now. You can just visually, you can feel the uncomfortable effects of having lymphedema. So it's uncomfortable, it's inconvenient, it's expensive to treat, it cannot be cured, and at best can be managed and monitored. So lymphedema is similar to edema, but there is one key difference. Lymphedema is a protein-rich fluid, and it's protein-rich because the lymph nodes that in an uncompromised system process large molecules have now been damaged or removed during diagnostic procedures or treatments. So anyone out there who's had a lymph node biopsy, whether the results were positive for cancer or not, or anyone that's had radiation or surgery or liposuction or breast reduction, anybody out there that's experienced any of these things is at risk for a lymphedema diagnosis forever. So lymphedema sometimes can be triggered during cancer treatment or shortly thereafter. We've known people who've been 20 years out of treatment and all of a sudden their lymphedema is triggered. It's not curable. It's not reversible. At best, it can be managed and monitored. And I've seen more cases of lymphedema triggered by skin therapists than by massage therapists. So that's something that we need to be thinking about with our clientele is I don't want to be the person that triggers someone's lymphedema to become active. So why is it that more skin therapists are triggering it than massage therapists? And it possibly is because we use heated hand mitts. Maybe it's because the strokes that we do on the décolleté area. It could be the heat applications that we utilize, or maybe it's general lack of oncology training amongst therapists. So I can't highlight enough that we don't want to be the therapist that triggers or aggravates a client's lymphedema. So we've reviewed questions to ask our client that we know is in active treatment or is actively going through a cancer journey. But what about all of our other clients? What about the ones that maybe we don't know about? A great way to identify the oncology client in your practice, and one of the most important consultation questions you could ask every client that you ever come in contact with is, have you ever had a lymph node compromised? Have you ever had a lymph node compromised? So this is something that you may want to start doing as homework right now. And I know that it's a strange question to ask if you haven't stated it before. So as homework, I'm just going to tell you to maybe start asking everyone you know, hey, have you ever had a lymph node compromised? You're going to be surprised at how many people say yes, or they don't know what you're talking about. No, I'm just kidding. They may not know, or they may say yes, or they may say, I've only had one removed. Yes, I had a biopsy done because I had a swollen lymph node. It may not have been a diagnosis of cancer, but they still had that lymph node removed, which means that the load that that lymphatic system takes in that area is not being processed the same. So anyone that's had a lymph node compromise, no matter what, is going to be treated now as an oncology client. So it's always hard to decide what to address in a short presentation because it's important for us to give you information that you can take home and put into practice tomorrow or today. The first thing I want you to do is the homework of asking people if they've ever had a lymph node compromised. But also something that you can do now is you can do a hand massage that's only that. You're massaging just the hand. So not all the way up the forearm, not all the way up the upper arm into the armpit area. Do all of those amazing tips and tricks that you've learned along the way and focus that hand massage on just the hand. And then you're going to know that you're not risking triggering lymphedema in that client. The other thing that you can take home too is if for some reason you know that you have a client that has a history of thyroid, head, or neck cancer, do not take your strokes up any longer on the neck area. So reverse the direction of your stroke, bring it down across the neck, and you know that you're not going to be at risk of triggering lymphedema for those who've had thyroid, head, or neck cancer treatment. So it's a little bit of some of the things that we cover. As I mentioned, it's just a quick snippet of information for you. If you want to go out and do some more research, then I recommend going to Greet the Day Spa, and it's at www.greetthedayspa.org. Now, this is a website that is created for a cancer patient who's looking for trained practitioners, but it's really great at helping us understand what they need to look for. So how to select a therapist, how to find a spa that offers specialized services, also what keeps that spa a safe environment for them, and that is that they're getting a customized service to their needs. This is also going to be a place where you can find best care practices and policies that we encourage spas to adapt. So Greet the Day Spa is a great website to check out. For the therapists out there that are also dual licensed, you may look at the Society for Oncology Massage. So if you've already done, if you are a dual licensed massage therapist and you've already done some training, chances are likely that you've gone on to Society for Oncology Massage and become one of the therapists on their therapist locator. For estheticians, I say go on to Society for Oncology Massage, check out massage therapists that are in your area, and maybe you can do some promotions together, or maybe that person's willing to sit down and talk to you about their experiences working with this oncology population, the pros, the cons, everything that comes along with it. We do have other classes available. So I'm going to state it one more time that this is just the start of a very large topic of conversation when you start thinking of treating this clientele. There's no way to avoid working with clients who've had lymph nodes removed or compromised. There's simply too many clients out there who've undergone procedures that affect lymph nodes. All therapists everywhere should be intimately familiar with lymphedema information. For those of you that are interested in opening your doors to clients in active cancer treatment and recent recovery, then I say add to your training goals our 3-day industry expert workshops, which we have in partnership with International Dermal Institute. I think there's a couple future dates that are going to come up pretty soon. I want you to know that the foundation education programs are offered by Greet the Day staff. We also oversee the infusion centers and hospital inpatient programs. But the other advanced education, the specialist education, we hand select instructors from all over the country. And they offer these specialized programs with us every other year. And usually on site at cancer centers. So this year, one of my favorite classes is coming up, and that's with Lauren Cates, and that's Presence at the End of Life workshop, which is slated for October this year. We'll see how it goes. So this isn't a necessity for somebody who's interested in working with this clientele, but I think it's a grounding experience that will really help you become prepared, especially if you're opening your business to all stages of cancer, all stages of life. So on a positive note, most people survive cancer. Not everyone does, though, but that's part of the life process. You know, not all of us are going to survive this life, not any of us. Working with this population every day is a constant reminder to live life while being present. And I just want to thank you all so much for your presence here today. And thank you for your patience and understanding and for holding space. We are going to open up for questions. So I'm going to check in with Beth and
Okay.
Hi.
Hi. So we definitely have some questions for you. If we want to, we'll go ahead and take these. So I have a few listed down here. So I'm going to kind of go through them as well. So the first one is, hi, I can't take the 3-day course, but what are other resources that are available that could help me learn more? And I know, Carrie, you gave some great resources and links there to Greet the Day.
Mhm.
Do you have any other suggestions?
Um, so one thing that people can do is, as licensed estheticians, they can volunteer with the Look Good, Feel Better program. Um, so that's a good way to get some experience with people that are in active treatment, also in recent recovery. And that's put on by the Professional Beauty Association. And if anyone's interested in more information, that's a good stepping block. I think that definitely the 3-day is the way to go. I understand that not everyone can do that. So maybe if they want to get a feel for what it's like working with this clientele, that might be the road for them to go.
Okay. Okay, great. Awesome. Thank you. The other question is, do you think that there might be in the future like de-streaming or video streaming that could help someone learn how to apply these techniques or understand these techniques in the future? I know really it's about being hands-on, but do you think you'll do anything in the future that might be some virtual applications?
I think that Jonette, my counterpart, has been working on some things. I don't know for 100%, so please don't hold
Okay.
me to this answer.
That's okay.
Um, because, as you mentioned, Beth, the hands-on experience, we're one of
Hmm.
the only classes that will bring in active cancer patients for the 3rd day practical of treatment
Hmm.
of class. And I think that that is where everything comes together. And that's just something you can't do virtually. You can't feel how that skin feels. You can't really have
Right.
that experience. So I think we could do some of it that way, but it would still, you would still need to come in for the hands-on
Yeah.
portion.
So yes. Okay. So we'll just keep everyone posted with Greet the Day if there in the future there's any opportunity where there's like maybe a theory portion just to dive in a little bit deeper. I mean, our webinar today was just kind of the just tip of the iceberg, a little bit of the just really getting into some, top, line information. You mentioned, Carrie, earlier when we were talking about hair loss that there were a couple names of a cooling cap that you
Yes.
preferred. Could you list those again?
Okay. It's not that I prefer them.
Okay,
It's just that there are 2 brands that are currently approved by the US Food and Drug Administration.
got it, got it.
One is called DigniCap, DIGNI, second word cap, CAP. And the second one is called Paxman, PAXMAN, cooling systems.
Okay,
There are multiples on the market. Those are the only 2 at this time that are currently cleared by the FDA. There is penguin cap therapy. Anytime they look up head cooling treatments for chemotherapy, a bunch will come up. As therapists, they may want to say these 2 are approved by the FDA, but I
mm-hmm.
think that they're also demographic specific. So I'm not sure that DigniCap is throughout the United States or Paxman's throughout the United States. I don't know.
Okay,
So I know that some people have difficulty because they're very popular treatments. Sometimes people have difficulty getting in touch with one, so it's good to know of the others out there as well.
okay, great. And then if someone's interested in the 3-day course and they want to either sign up for that or they want to receive updates and emails from Greet the Day, should they go onto your website or what would be the best area to do that?
Yeah, I would go to the Greet the Day website and there's a sign up for a newsletter on there somewhere. Um, we could follow up. I don't I should probably get that more accurate. I can maybe get it to you and we could send it out.
Yeah,
Um,
great.
and then also, you know, in partnership with International Dermal Institute, you guys do lots of marketing for us too. So
Correct. Yes, yes.
yes.
And I know there's a lot of questions about West Coast, East Coast, you know, where we're going to be hosting the 3-day skincare oncology seminar or course that we actually work with you in collaboration. So right now we are looking at our West Coast states, and we are looking at East Coast states, East Coast being more towards into Chicago. And we'll be sure to keep everyone updated on that as well. And like Karey said, we always like to make sure we're promoting and marketing and giving you guys the most advanced information when it comes to signing up for these types of courses. I have a great question here is, do you have any suggestions of the best way to market this service after you've been trained?
I think that opening up a conversation with some of the professionals, the oncology professionals in their area is one good way to start. So if you sense a hesitation in my voice, I just want to let you know that cancer professionals are very protective of their patients. So
Mm-hmm.
if you approach a hospital and say, I want to talk about, you know, my new knowledge, sometimes you're going to get a lot of, we're not interested in that. Even if you're doing it as a free class or lecture, you may have better luck contacting a support group in the area or asking some of your existing clientele that you know has gone through a cancer journey if they have either a support group that you could do a presentation on, you know, the needs in changing skin and how to help address that. I think when it comes to promoting the services, it's really interesting because, as I mentioned before, um, sometimes people want to give away their services to this clientele, and I'm the first to say that you're getting advanced education. Your fee should be in line with your advanced education. So I would hesitate from telling you to do free services for cancer patients because all of a sudden you're going to be 24/7 filled with
Mm-hmm.
patients that want free services. So this is a long way of saying that you might want to do a promotion where you give one free treatment per year per diagnosis, or you, for a month, maybe breast cancer is of interest to you, but maybe you're interested in a different type of cancer. So March is 3 different cancer awarenesses. It's colon cancer awareness, kidney cancer awareness, and multiple myoma. So maybe for 1 month, maybe you have a family member that's gone through ovarian cancer. Maybe for that month, you offer a roundup for cancer care. So as you're taking payment from your regular client, you can round up like the 50 cents per treatment. So that goes to a donation to a patient that needs a treatment right now. I
Mm-hmm.
think whenever you can promote with your business that you've advanced your education. So doing something like this, a short webinar on your knowledge and how you want to spread this to the community is a great way to promote your services as well.
Okay, great. Do you, we've got time for about 2 more questions here. And again, if you have put through a question and we don't seem to get to today, please know that we're going to follow up with just a quick Q&A fact sheet that we'll be able to email out to our attendees so everyone has those answers as well. And so the question is, if someone is taking oral medication,
Uh-huh.
probably like a PARP inhibitor, and they have the okay from their doctor, is it still okay to work with them if we follow the less rule, even if I haven't been trained in oncology treatments?
Mm.
I think it's a tough one, right?
Yeah, because there's no one size fits all answer in providing treatments.
Mm-hmm.
So um, you know, it depends on the type of cancer, it depends on the type of treatment, it depends on
Okay.
the experience of side effects. I'm afraid if I say yes, that people are going to start working on,
Right.
they're going to use the Lesterol on all their oncology clients, and that's
Right.
just um, too small of there's too much that could go wrong. And as I mentioned earlier, we don't want to be the therapist that creates problems, and
Right.
we don't want to be the therapist that has great intentions, and so we do our best Lesterol but still create a problem on that skin. It can be very erratic, the skin. It could be reacting to things it's never reacted to before.
Mm-hmm.
So I hesitate in saying, yes, just implement the Lesterol and you'll be fine,
Right.
because
Right.
there are way too many clinical considerations that need to be
Mm-hmm.
taken into consideration, and also they're constantly changing. It's always a moving target.
Okay.
So 3 days, although sounds like a long time, is barely enough to get you comfortable in knowing what to look for.
Okay. So maybe just really kind of erring on the side of caution, and then, having that patient just really having that deeper conversation, with their doctor. Okay, great. No, great answer, Karey. We really appreciate that. There was a question back when you were talking about lymphedema, and you mentioned lymph nodes being compromised. Does that mean if they're removed, if they've been tested,
Mm,
or does it mean both? Could you elaborate
that's
on that a little bit further?
such a great question.
Right?
So, a lymph node being compromised, it could be a biopsy. So someone has the potential for cancer as a disease process, so their physician has done a biopsy. So the interesting fact is that not everyone that gets a biopsy has a cancer diagnosis. So
Mm-hmm.
anyone that's had a biopsy has had their lymph nodes compromised. So there's that person. Anyone that's had treatments like radiation, even if they don't remember having a lymph node um, compromised in any way, shape, or form, that radiation beam compromises the load that those lymph nodes are able to take on.
Mm-hmm.
So if it's in the groin area, then their inguinal lymph nodes are compromised. If it's in the upper chest area, then it could be the axilla lymph nodes that are compromised. So, you know, it doesn't necessarily mean that it's been biopsied or removed. It could just have been affected by the treatment that's happened. Or then you can even open it up broader. Some people that have had liposuction or have had breast reduction surgery, the lymph nodes have been compromised in those areas as well. So realistically, the population that's had a lymph node compromised is very, very large. And anyone that's had it compromised, whether it was with a diagnosis or not, needs to have stroke modifications forever utilized during their facial and massage treatments. So depending on where that lymph node was compromised, we may
Mm-hmm.
adapt our facial treatment accordingly. So as I mentioned with the thyroid or head and neck cancers, we would bring those strokes down versus up, because we don't want to load a compromised lymphatic area. Does that make
Right.
sense?
Mm-hmm. Yeah, definitely. Okay. And last question, and then we'll close up our day. And again, you guys, just to remind you, we are recording everything today, so we can come back in and watch, and we'll send out some Q&A answers after our call today as well. Should we avoid like like using electrical devices on the skin for um, a cancer patient? That's number one.
Uh-huh.
So obviously avoiding things like
Yes.
galvanic. Yes.
Mhm.
Okay. So that's a yes from you, correct?
So this is the thing.
Okay.
Uh, you'll have to check with the maker of your electronic device,
Got it.
but I'm going to say most of them have not done testing on
Mhm.
oncology clients. So it's
Right.
really safer to say not to utilize those specifically on people that are in active treatment and recent recovery.
Mm-hmm.
Um, somebody that's in long-term survivorship, then, you know, their skin is getting closer to what their normal was.
Mm-hmm.
But again, for a true answer, you need to talk to the manufacturer of the electrical modality.
Okay. Okay, great. And then on top of that, then, if someone has, let's say, for example, a port in by their décolleté, and or
Yes.
a device there,
Mhm.
should that area be completely avoided? Is that something you teach in your class?
It is something we talk about, and so a portacath is a medical device that's planted just underneath the skin. So
Mm-hmm.
the skin will be covering it, but it's accessed either to administer chemotherapy or to take the blood draws. So it's broken, the skin is broken quite regularly. It is smarter to not work, and we're trained not to work near a medical device. So we would not work on the chest area of someone that has a portacath that's been recently implanted, or that is, well, first of all, if it's recently placed in, they're going to be very uncomfortable anyway.
Mm-hmm.
They're not going to want you to be touching it. But also, we don't want to stay near any medical device when doing treatment. So usually it's at the lower underneath the clavicle. So we can still do a really delightful facial treatment without including um, just above. Did I say below? Just above the clavicle. So we
Mm-hmm.
can still do a really great facial treatment from the neck up.
Okay.
So
Okay.
just
Perfect.
keeping out of that area because we don't want to touch a medical device.
Gotcha. Okay, great. Hey, Carrie. Well, thank you so much. We appreciate your time. Just to kind of remind you guys again, if you have any, thoughts or comments, and you want to just do a little bit more information, research, again, Greet the Day website is really great. We also have their Facebook page listed here for you on the screen. Also follow them on their Instagram page, greettheday_nonprofit, because those are always great ways to see the most up-to-date information and courses that are coming your way. So as we close up the day, again, Carrie, thank you so much. We really, really appreciate your time. Guys, we hope also too you stay in touch with us at dermalinstitute.com. We've got more webinars coming your way this year. We also have a brand new membership program. So if you haven't been able to join us and log into that, please check out that information under dermalinstitute.com under membership, and we can give you all the good information on that. We also too are just, again, continuing our skin series and our master expert workshops in IDI streaming. So a lot of you I know are really loving to tune in a virtual application, and this is a great time to do that. So you can, again, connect with all of that on dermalinstitute.com. So looking forward, Carrie, for us to partner again this year for those courses that we have. Again, Greet the Day is another, again, a great example of just an organization that's doing so much amazing and great work. So thank you so much, Carrie, for being here.
Well, thank you so much, Beth. I really, really appreciate you taking the time to make sure that this information is out there. So thank you. And thanks, everybody. Stay safe, stay healthy.
Great. Awesome. Thanks, Carrie. Thanks, everyone. Have an amazing day, and stay connected with us, and we'll see you on our next webinar.